Hey everybody, my name is Shelley Anthony and I am a dental hygienist with Senior Dental Care. I currently live in Florida providing care to the nursing homes in the greater Jacksonville area. And I've been practicing dental hygiene for about 27 years. So I'm really excited to be with you here today. Thank you so much for taking the time to watch this webinar. If you have any questions, type them in the chat box below. Dr. Flesher, one of our dentists, as well as Jeannie Jadnek, a fellow hygienist, are standing by to help answer these questions. And of course, if you're watching this at a later date, you can email me directly at santhony@myseniordentalcare.com. My goal with this webinar is to help you understand the importance of good oral health and make it clear that there is a correlation between oral health and one's overall health. By doing so, you'll understand how oral infections such as tooth decay and gum disease occur. Because the majority of our nursing home residents have compromised immune systems, I think it's really important for me to point out the most common systemic conditions that studies have shown to be linked to poor oral health. So let me just start by saying, in a nutshell, it's all about the bacteria. We have over 500 species of bacteria that thrive in our mouth at any given time. Some of them are good and some of them are bad. The good news is that our body's natural defenses and good oral health keep these bacteria under control. Also, our saliva helps to protect against disease-causing bacteria. The bad news is that poor oral health can result in very high levels of bacteria, leading to oral infections, such as tooth decay and gum disease. Now, it's important to note that the mouth is the entry point to our digestive and respiratory tract. Harmful bacteria that are in the plaque can enter the bloodstream through the gum tissue and cause health conditions in the body. Therefore, dental health and daily oral care are crucial for our residents' overall health. Just briefly, let me explain how the gum disease process works. We have plaque, and that's a soft, sticky, colorless film that adheres to our teeth. This is what we brush off every single day, and it is full of bacteria. Now, when that plaque is not removed regularly, sometimes even within a 24 to 48 period, that plaque turns hard. It's called calculus or tartar. Once that's hard, that provides a large sticky surface for more plaque to grow on. And this creates an environment for more bacteria. Again, like I said, we're unable to remove this once it turns hard. This hard tartar causes inflammation, swelling, bleeding, and a low-grade infection of the tissues that support our teeth. The longer that this tartar is on our teeth, it starts working its way down underneath the gum line. And when this happens, it starts destroying the bone and all the supporting structures that hold our teeth in place, ultimately can result in tooth loss. Gum disease is a chronic bacterial infection, and the more severe that this gum disease is, the greater risk to health conditions. That brings me to discuss some of the common conditions that are linked to poor oral health. The first one is endocarditis, and this is the infection of the inner lining of the heart chamber. This can occur when bacteria from other parts of our body, such as the mouth, spread through the bloodstream and attach to certain areas of the heart. Now, cardiac disease and stroke are two other common conditions. Again, the oral bacteria that are in our mouth can enter the bloodstream, attaching to the fatty plaques in heart's blood vessels, contributing to formation of clots. Studies and research also suggest that there is a direct link to the oral bacteria that causes inflammation and infection to cardiac disease and stroke. Research also suggests that patients with gum disease are 3 times likely to suffer from heart disease or stroke. The one disease that confirms to be significantly affected by poor oral health is diabetes. And this disease goes both ways. Patients who have gum disease increase their risk to develop diabetes. Gum disease hinders the ability for the body's ability to use insulin. Now, on the flip side, a diabetic patient, because they tend to suffer from dry mouth, that's a contributing factor to gum disease. And gum disease in diabetics also appear to be more frequent and severe. Now, the diabetic patient who also has gum disease find it more difficult to control their blood sugar levels. Studies also suggest there is an increased risk of premature death by 400 to 700%. The next common condition is pneumonia, and this is really prevalent in the nursing home facilities. Studies have shown that one of the most common respiratory bacteria in the mouth and plaque is pneumonia. And what happens is that overgrowth of bacteria in the mouth can be breathed into the lungs. And finally, the last condition, and more recent, is Alzheimer's disease. Alzheimer's disease, studies have confirmed that the bacteria that causes gum disease has been found in the brains of Alzheimer's patients, both living and deceased. And this continues to be an ongoing research. So consequently, I think we can all agree that these specific conditions are frequent among our residents. And as a result, dental health is directly related to the well-being of our residents. More importantly, daily oral care for our residents is an important aspect to the quality of their life because there is a correlation between chronic oral infections to one's overall health. Just remember, the mouth is the window to your body's health. We hope this webinar has been informative and helped to better explain the importance of good oral health with our residents. Please be on the lookout for a follow-up survey. We greatly appreciate your feedback. And on behalf of myself and the entire senior dental care team, we truly want to thank you for all that you do. Thank you. Thanks for joining us, and welcome to the Q&A portion of the webinar. I have Dr. Flesher, one of our dentists, along with Jeannie Jandek, a fellow hygienist, that are here to help answer any questions. So let's begin with some questions. We actually have one that came in. Can you still have issues with your gum tissue if you have dentures? Absolutely. Plaque and food and bacteria can collect on and around removable dentures. And this can create poor oral conditions in the mouth. So it's really important to keep the oral cavity clean as well as your dentures. Thank you. Okay. Are people who wear dentures at risk for systemic diseases due to poor oral health too? Or is it just people with natural teeth? Dr. Fletcher, you want to take this one?
Yeah, and I'll add one thing to the previous thing too. We're still going to check the mouth for injuries. Obviously, we're going to eat food, and sometimes crunchy things are going to affect gum. So we definitely want to make sure that nothing is being injured in the mouth. And, the body's cells are turning over in the mouth too. So even with or without teeth, we want to check the hard and soft tissues to make sure there's nothing growing or nothing discolored. So even though there's no teeth and typically less potential for a source of pain because of that, there's still things that we're checking on there. Specifically to answer the question with people being at risk for systemic diseases, yeah. So kind of what I just talked about, not everything related to teeth is still going to be present, but there still are some bugs that are related to gums, and like Shelley talked about in the video, correlation with other things going on like Alzheimer's, diabetes, that kind of thing. So we definitely want to be aware of the mouth being the gateway to a lot of other systems in the body.
Thank you. We have a question. How often should dentures be removed and should they be slept in?
Yeah, that's a great
Typically, we
question.
like patients to take their dentures out at night, but some patients are funny about that. They don't like to, but it is important that they remove those dentures at least 4 to 6 hours a day to allow the tissue to breathe and to clean them. Dr. Fletcher, anything you wanted to add on that?
Yeah, I mean, the main purpose for that is obviously if they're not being removed, they have an underside that's not being cleaned, the side that's touching the inside of their mouth. So bacteria, food, I mean, they're not sealed perfectly, no matter how perfectly they're made or how well they're you know, adhesive in the mouth. There's still stuff sneaking in. And so we want to make sure that we physically remove them to clean the side that we can't see. And then at a microscopic level, it's harboring bacteria, and pneumonia is a major potential issue there with keeping it in too long. So letting your mouth breathe, in addition to physically removing them to make sure you're fully cleaning them, is kind of dual purpose there for you and the appliance.
Is there a higher plaque formation for our residents or people as they advance in age?
So the process is the same regardless of age, but there's often a lot of additional contributing factors with age. So just some medicines, some complicated health histories, other systemic contributors. So the process itself is the same, but just the ability for the body to fight that off and have kind of a homeostasis, kind of a neutral state where it's keeping up with the formation is going to be lessened typically as you age. Not always, but typically, just because of those other contributing factors. You know, dry mouth is a huge side effect of a lot of medicines, and when you start to have a laundry list of medicines, then they really pile up. And if your saliva is not clearing away the food and the debris and the bacteria, then that stuff's sitting there longer and it just snowballs a lot quicker.
Yeah. What is the best thing a CNA can do if the resident doesn't allow a full toothbrush cleaning? Ironically, we're going to be covering this next week in our seminar, Basic Dental Hygiene for the Caregiver. So, Jeannie, do you want to touch on this a little bit?
Well, I know there are a lot of residents that it's hard to access their mouth. I just say do the best that you can. Anything you can do helps. And the way you approach a patient or resident also makes a big difference. And again, next week I'll talk a little bit about different things you can do to help ease compliance by how you approach a patient.
And we hinted at it a little bit last week when we were talking about emergencies and how different time of day, different provider, different instrument. If a toothbrush is not being allowed, some sort of swab or clean washcloth. I mean, vary up the approach to see if something about any one of those pieces helps the equation for sure.
Yes, time of day can make a big difference. I know some residents are more compliant in the morning versus the afternoon. Some are more compliant in the evening, so that can make a big difference too.
Mm-hmm.
Yeah. Is plaque bacteria contagious?
Yeah, so we don't have any proof that it is, but we strongly believe through different studies, going back to even when you're an infant, typically you don't have the plaque forming bacteria until somebody shares a meal with you or your mom blows on your food to make sure it's not too hot or tastes it to make sure it's not too salty or whatever. And that exchange in exchanging bacteria in the mouth is what kind of starts the process of having those same bacteria in your own mouth. So in the same way as adults, spouse, or anybody that you're in close contact in the home, if you're sharing meals, there can definitely be an exchange of bacteria that would contribute to tooth decay and sometimes even gum issues as well. So sometimes when we're treating a resident or a patient for gum issues, if their spouse has those issues and we're not seeing them and treating both people at the same time, the ability to fight that off and recover from it is going to be lessened in the one person that we are treating, because they're going back and getting kind of reinfected, if you will, from their spouse or significant other.
Will you be giving a webinar about how to clean residents' teeth and dentures? Yes, we will. Actually, it's going to be 2 seminars. Like I said, next week, Jenny's going to be covering natural teeth, and the week following that, I will be covering denture care. So stay tuned for that.
Okay.
Any other questions? I do not see any other questions coming in.
No, I think
So thank you guys so much for joining us today, and we look forward to seeing you next week for our new webinar, Basic Dental Hygiene for the Caregiver. Thanks again.